Hi, welcome and thank you for taking effort to look at this e-poster. My name is Siderius and I'll be the presenting author of this poster. Ankylosing spondylitis, abbreviated AS, is characterized by both excessive bone formation and bone loss. Our previous study demonstrated that 3 years of TNF-α blocking therapy results in a significant increase in bulb. Longer follow-up is needed to investigate whether bulb stays elevated during TNF-α blocking therapy and also to explore the course of other bone turnover markers. The objective of this study is to investigate the prolonged course of serum markers of bone formation and resorption during 10 years of TNF-α inhibiting therapy in AS patients. To study this, we included consecutive AS outpatients from the Groningen-Leeuwarden axial spondyloarthritis cohort who were treated with a TNF-α blocking therapy for at least 10 years, with a maximum of 2 types of TNF-α blockers, and we excluded patients using bisphosphonates, and data for a specific visit was defined as missing in case of fracture or systemic corticosteroids within 1 year prior to the visit. BTM were measured at baseline, 3 and 6 months, 1 and 2 years, and thereafter biannual. Z-scores of BTM were calculated using a matched 10-year cohort of a Dutch reference group. General estimated equations, or GEE, were used to analyze BTM over time within subjects, and simple contrasts were used to compare baseline and follow-up visits. P-values below 0.05 were considered statistically significant. This led to 29 AS patients eligible for analysis, and we found that bone regulation marker osteocalcin showed an increase only after 3 months compared to baseline. Collagen resorption marker SCTX Z-scores, depicted in figure B, significantly increased after 8 and 10 years compared to baseline. This increase remained significant after correction for disease activity, vitamin D levels, TNF-α blocker dosage, and the ASAS NSAID index, of which the data is not shown. Collagen formation marker P1NP was significantly increased after 3 and 6 months and 2 and 4 years compared to baseline. Last, bone mineralization marker BULB showed the largest increase of all BTM, which was significant at all time points up to and including 4 years, but thereafter levels of BULB returned to baseline. To conclude, in this long-term cohort of AS patients with established disease treated with TNF-α blocking therapy, bone turnover balance favored bone formation during the first years of TNF-α blocking therapy, which corresponds to previously reported improvement in bone mineral density, especially at the lumbar spine. Markers of bone formation SCTX increases significantly after 8 to 10 years, so long-term effects of TNF-α blocking therapy on the bone metabolism should be studied further. Thank you for listening, and should you have any comments or questions,